Hello viewers, I'm Alana Erickson, and I'm the Communications Specialist at the Winnebago Health Department. Today we are joining you for a takeover of Rethink's TV show. As the hosting agent of the Rethink Healthy Living Partnership, we are proud of all the work that Rethink does within the community to make it healthier. But we realize that some folks might not be aware of the connection between Rethink and the local health department, as well as some of the other major programming at the health department manages. Today, we have some guests here to talk a little bit about the recent involvement of the Winnebago County Health Department and what types of services are being provided behind the scenes. Let's dive right in with our first guest, Director and Health Officer of the Winnebago County Health Department, Doug Gieryn. Welcome, Doug. So can you tell me a little bit about how many years you've been with Winnebago County Health Department and your journey to working here?
Sure. I started with Winnebago County Health Department in 2004. I've been here over 12 years now. Prior to that, I worked for the City of Milwaukee Health Department. I was there for about 11 years. I worked mostly in environmental health, communicable disease, tuberculosis, preparedness, refugee health, a wide variety of programs.
Lots of experience.
Mm-hmm.
So when you came here, Winnebago County Health Department looked a little bit different, and I understand they went through some transition in recent years. So can you tell me a little bit about that?
Sure. Back in 2004, the health department, like most health departments, was largely based on public health nursing. Most of our services were direct service to the community. There's been a transformation in public health at a national level. We have been a part of that transformation, and so we've evolved our department to really adapt with the needs and intent of public health services in our community. We've done that through some growth internally. We added on extra capacity in environmental health. We added on environmental health specialists. We certainly, in order to do that, we certainly sought out new sources of revenue. We created the Rethink Coalition at one point that still runs today, and then in about 2012, after a couple of years of work, we actually consolidated health departments within Winnebago County. There used to be 4 individual departments in Winnebago County. Now there are 2, the County Health Department and the City of Menasha. City of Neenah and City of Oshkosh consolidated with the Winnebago County Health Department in 2012. That consolidation, which took considerable time, did save some resources for the community. It saved money for the taxpayers. It enhanced our capacity in terms of the number of staff we have. It also allowed us to really get more expertise in certain areas of the department that were really necessary to help move public health forward.
Great. Well, this is one of the first shows that really the health department is taking over, and there might be people out there that aren't really quite aware of what public health is or what your local health department does for you, what the services are. So can you explain broadly what that is?
Sure. So in Winnebago County, we like to think that most health departments operate the same, but every community has unique needs. Mm-hmm. And so we adapt the services of the Winnebago County Health Department to the needs unique to our community. If you're looking at our overview of our services, we have a pamphlet that we hand out. We have a wide variety of services, and it's going to be tough to do it justice in the short time that we have. But some of the newer functions that we have is your role, for one, as a communication specialist. It's really important for public health to promote information, share information, to engage partners, and a communication specialist really helps us engage not only digitally and social media and through ventures like this, but also with routine communications and ensuring that we're informing the public in a timely manner. Mm-hmm. We've added a public health preparedness position that will help us prepare the community and prepare our staff for public health emergencies. Over the years, we've made a number of plans, mass clinic plans, pandemic influenza plans, mass fatality plans, and those are all in an effort to help us be more resilient, help us be more responsive to any crises that occur within the community, and in working with our other community partners. We've also added a planning component. to help us invest more resource in working on our strategic plan, working on our community health needs assessment, working on our community health improvement plans, applying for more grants, and helping advise the health department as it moves forward in seeking things like voluntary national accreditation.
Okay.
That's in our administrative section. Those staff are available for our entire agency and for the community. And we also have a number of support staff that assist with that. And in addition to that, we have our major program areas. Environmental health, staff of 5 that most of the time are licensing and inspecting various establishments, restaurants, hotels, motels, so basically lodging and food establishments, tattoo parlors, swimming pools, mobile home parks, and a variety of other licenses. In addition to that, that environmental health unit really needs to be available to respond to adverse environmental threats. Issues that are important for us here in Winnebago include things like arsenic in water, well water versus municipal water, issues, blue-green algae on Lake Winnebago, and then a variety of nuisance issues that we respond to, things like bed bug complaints.
Let's hope not.
Yeah. And animal health is another area. Rabies, all animal bites get reported to us. We follow up on that. We have just last year we had two bats that were diagnosed with rabies or tested positive for rabies. That really helps enhance it, let us prioritize that program and make sure that we're really diligent on following up on those animal bites. In our communicable disease section, there's a long list of communicable diseases that are mandatorily reported to local public health departments, and those are typically diseases that can be transmitted from one person to another, are fairly serious in nature, and we respond to those reports by contacting the individual, trying to stop spread, find out what the source of that disease is. We receive probably over 1,200 reports of communicable diseases every year. A large number of those, unfortunately, are sexually transmitted diseases. We also, in our communicable disease section, work with immunizations, making sure that the public has a place to go for immunizations if they can't get one from their primary care provider. Refugee transition into our community, needle exchange, and HIV. Partner referral, investigation, that sort of thing. In our health promotion and wellness sections, those sections are made up of a variety of nurses and health educators primarily. We offer programming related to chronic diseases, nutrition, physical activity, obesity, tobacco prevention, drug prevention, working with our community partners on mental health, our heroin task force.
A lot of what people see in the community.
Yes, and then on the nursing side, our family child health programming, helping ensure healthy babies, helping ensure healthy aging, and programs, those direct services that that we can provide to help enhance health across the lifespan. And then our WIC program, a large program that is offered in both our locations to provide nutritional supplements and vouchers, nutrition education to children up to age 5, pregnant women, breastfeeding women, and that's a quick overview.
Right. Well, I know that all this information is on the website. You can go on there and see the different programming that the health department provides. Also recently, we've really been trying to ramp up our conversation on social media, providing little glimpse of what happens at the health department, how you can get involved in events that are coming up. So make sure to check that out at www.winnebagopublichealth.org.